So what's being done to address this? Government and community initiatives in education programs, health services, and treatment programs, they're tackling this in various ways in different areas. We've got the National Drug Framework, the National Aboriginal and Torres Strait Islander People's Drug Strategy, Closing the Gap, the National Illicit Drug Strategy, the Australian Drug Foundation, and Life Education Australia. There are plenty more. These are just some examples. So here's an outline of the National Drug Strategic Framework. Just have a quick glance at it because the Indigenous version is based on this. However, what is different is for the Indigenous population, they've included the Aboriginal and Torres Strait Islander ownership of solutions and the holistic approaches to treatment. This holistic approach is really important because Indigenous people tend to view healthcare from the holistic point of view, whereas many Western values, look at individual problems in their individual components and not at the whole person. Community innovations. What's going on in communities to overcome Indigenous alcohol and drug abuse? So CTG, Closing the Gap, that was a big move forward by the government to, close the gap between the life expectancy, the education, the health. The Australian Drug Foundation has so many grassroots campaigns going. They've got things like the Western Alcohol Reduction Program, the Other Talk Program, workplace drinking culture programs. They're addressing drinking and drug use on a bigger scale, not just Indigenous communities. We've seen things like the WIC decision where the Native people have taken control back over their own lives and resources and opportunities, and they've made a success of it. And we want to be promoting these things and saying that you can do it and helping these communities reach this. And programs such as Life Australia, Life Education Australia, work with local schools to educate people. So are they effective? Yes and no. The treatment for alcohol and drug abuse does fluctuate in effectiveness. It depends on so many factors: drug availability, user demographics, community attitudes, government policies at the time. These things do fluctuate and change, and so does the effectiveness of treatment. Just briefly, Oxfam found that the CTG program was an essential failure and remained in name only, which is really not a very positive thing for our Indigenous people. The Australian Drug Foundation has significant success with various grassroots campaigns. Life Education Australia has also had success with education. However, one Western Australian study found government and community initiatives for addressing alcohol and drug abuse ineffective due to a lack of communication, trust, funding transparency, clearly defined goals and responsibilities, and common ideologies. The whole thing here just didn't work. One worker in this study actually said, we need to do the whole welcome for country for Indigenous people because they're coming to lands that aren't their own, and they're just being treated by all these different professionals that don't build the relationships that you need. So let's look at education policies. So policies for education basically go for the harm minimization over the abstinence approach like America does. There are so many different state and federal government education policies, and many of these can be found online. Basically, the need for schools to develop these policies, they have to align with legislation and department policies, and that the principals, teachers and staff have to place the students' safety and welfare first, and often this means that anything told in confidence will still have to be passed on, so that can be a little challenging for teachers to build those trusting relationships. Two other programs, School Health and Alcohol Harm Reduction Project and Climate Schools. They're two initiatives that provide framework and materials for schools for education. They're quite effective as well. What could be improved here? So one study actually looked at the differences in the school policies for drug use between America and Victoria and Australia, and they found that there wasn't a great deal of difference between the abstinence approach in America and the harm minimization approach here. They did find, however, that external punishments such as suspensions weren't that effective, but counselling and more education was worth investigating. So I actually believe that greater efforts for students' mental well-being, education, counselling, and even positive drug prevention strategies can be used for a greater effect for youth, and for Indigenous youth, developing an environment in which peers don't tolerate the behaviour If the behavior is unacceptable amongst peers, they're less likely to do those actions, you know. Okay. We also need more community involvement and positive role models, especially for Indigenous youth. When you've got to deal with attitudes from elders and community members who had really negative experiences of school and who don't value education, we have to show them that it is possible to do something valuable with your life and do something that you want to do. You know, you don't have to be ascribed to the beliefs of other people because they had a bad experience. You know, we want people to rise above and be better. So yeah, and also stronger relationships between staff and students to have better levels of communication. So teachers and the curriculum. The Australian curriculum actually starts addressing drug use from grades 3 and 4, where it says that they want to help kids to overcome situations and give them strategies to deal with times when they don't feel safe or when they feel uncomfortable, and part of this relates to drug use and how to say no, which is excellent, and this carries on from grades 3 and 4 all the way through high school. Personalised learning plans are mandatory classroom documents for Indigenous students, and these are really important because they can help you develop strategies and classes for teaching about abstinence or how to avoid these things. You know, when you've got a plan that is more inclusive of all students, you're more likely to be successful for all students. And the teaching standards, you know, they want us to know the teaching strategies for Aboriginal and Torres Strait Islander students, and it's really important that we know this. We learn their culture, we learn their history, so we can relate to them better and build that relationship where we can make a positive influence. So what else can teachers do? Foster a strong sense of community and support, and try to help isolated students feel less isolated. We've got to help students to develop good mental health strategies, you know, giving them coping strategies so they don't turn to these things to cope. Communities and schools can offer more school clubs or activities, or especially communities for after school students. We want them to have better attitudes towards their bodies, towards their health, and to make better decisions. If you look at Iceland, they went from having one of the highest rates of heaviest drinkers in the world for teenagers to the cleanest living teenagers, and the way they did this was by giving them, the kids, a sense of community. They gave them fun things to do every day, and they had more parental involvement in their lives, and this was such a positive thing. We really need to start doing that here. And teachers need to work with communities to foster healthy lifestyles as a wider prevention strategy for all students, not just Indigenous. So some final thoughts quickly. The issue of alcohol and drug use in Indigenous communities is part of a wider Australian problem. Across the community, government, health and education sectors, results for curbing alcohol and drug problems have been mixed but overall lacking in efficiencies. Schools and communities have to work together to promote positive role models, healthy lifestyles, and provide outlets for youth. Education about the dangers of alcohol and drug use need to be accessible throughout all levels of the community, and having partnerships with communities and organisations that want to work together. We've got to make positive changes for Indigenous students and set a good example for younger generations. We've got to break that cycle. And governments need to focus on local initiatives to provide education, training, employment, health services, and investments in sustainability for communities to tackle the underlying contemporary issues relating to alcohol and drug abuse. If we don't address the root causes of the problem, we're never going to solve the issue of alcohol and drug use. I apologise for my speedy delivery, but I hope that you enjoyed the lecture. Thank you very much. And this is the reference list.